The expert guide to mini neck lifts. As I like to say, patients love the term mini neck lifts, but they don't always want mini results. In order to change someone's neck and reverse the signs of aging, a careful diagnosis of what causes that individual's neck aging is necessary. I believe that successful results in neck rejuvenation surgery start with an individualized diagnosis. That's to say, is the neck skin aging? Is the muscle or the platysma muscle banding excessive? Is there too much fat? Or is the skin damaged from sun, and is it crepey? Before we decide on any treatment, we have to make the diagnosis. Here's a guide. What is a mini neck lift? A mini neck lift is a procedure or procedures designed to tighten the neck and give a youthful angular appearance to the jawline. It involves an incision underneath the chin. We call this a submental incision. It's short, and incisions behind the ears. When present, excess neck fat is removed during the procedure. The muscles are often tightened or repositioned, and the excess or lax skin can be treated either with a device aimed at skin tightening or more traditional surgery with skin removal. The term mini neck lift utilizes a shorter incision than does a bigger facelift and a smaller field of dissection in the neck. This kind of procedure is most appropriate for patients with minimal signs of neck aging, maybe the younger patients. If a large amount of fat or skin laxity is present, sagging skin or a large amount of fat, a mini lift is often not appropriate. A traditional facelift is more appropriate. When a large amount of skin redundancy is present, we've got to go to that traditional neck or lower facelift. In many instances, neck laxity and poor definition of the jawline is associated with a weak chin. In these cases, I recommend to my neck patients that a chin implant is done along with a neck tightening procedure. This really helps. Liposuction of submental fat can also help. In young individuals, liposuction can be done alone with an improved definition of the chin and neck because the skin is tight enough and it redrapes. But in older individuals who have lax skin redraping after liposuction alone may be inadequate, and it requires neck lifting from the sides. I describe this to my patients as tightening the neck like a hammock, tightening the sides of a hammock. When we lift from behind the ears and tighten the skin, the neck tightening is like pulling the ends of a hammock and tightening the center. This snug and angular look to the jawline is what most of my patients want. Plastic surgery that removes excess skin and fat from around the neck, tightens and lifts the lower face, and manipulates the underlying neck muscles to achieve attractive rejuvenation of the neck, jaw, and chin area. When done by an expert plastic surgeon, a mini neck lift can have a dramatic anti-aging effect with fewer, smaller incisions and less downtime than does a traditional neck lift. The procedure is often done to fix a double chin, to remove sagging, loose pockets of skin under the chin, often called a turkey waddle. These are both very common signs of aging, and a full neck lift may still be the best solution for patients who have a lot of fat. Especially for patients who have lost a great deal of weight, the skin excess may need to be cut out in association with a neck lift. But for patients with only mild or moderate lower facial sagging, a mini neck lift can yield beautiful, long-lasting results. How long does a mini neck lift last? If we make a shorter incision with less dissection, usually the lift lasts less long. But if a patient practices good skin care, a mini neck lift can last a long time. It just depends on the genetic factors for that patient and the level of skin laxity. Generally speaking, the younger a patient is, the longer the results will last. A mini neck lift usually lasts about 5 to 8 years before most people consider getting a repeat procedure, but everyone's different. Note that some patients may opt to get injectable fillers as part of a mini neck lift, usually to augment the chin or jaw. In that case, fillers will need to be done or re-injected at an interval basis, though less filler is often necessary to get the desired result. What's recovery like after a mini neck lift? Mini neck lift recovery is generally a little shorter and a little less painful then is a full neck lift. The incisions are less long, the procedure is a little less invasive, and there's a little less trauma to the delicate tissue. Patients should expect to take about 7 to 10 days off of work and to wear a supportive neck garment for the first week after surgery. The deep stitches are dissolvable, but the stitches are removed, and the patient usually comes back in about 7 days for a post-op visit to have these removed. Most patients experience a pretty swift recovery, and any initial pain or soreness is easily managed with pain medications. As always, follow your doctor's post-operative care instructions closely and keep your head elevated, especially when sleeping, for the first few days after the procedure to reduce swelling and discomfort. To avoid complications, avoid rigorous physical activity for a few weeks after surgery. I tell my patients 3 weeks. Most patients are usually cleared to go back to work after 1 to 2 weeks after this surgery. Do you have questions about mini facelift surgery or other surgeries or anything relating to the face and neck? I'd love to help you. Call or email my office today. I look forward to seeing you in my office. Thanks again for watching.